I want to welcome everyone to this edition of Caring for Caregivers Mental Health Program. And we have a very special guest for the second time. She's a pediatric nurse practitioner, Erin Fesky, and one of our most favorite people in pediatric epilepsy. And you'll see why here shortly. Before we get into today's program, which is aptly titled Pouring from an Empty Cup, we'll want to spend a moment just giving a note of thanks to our sponsors, primarily DAS Pharmaceuticals, our primary sponsor, and to Neurelis for their support. We know that mental health for caregivers is an important topic. For some time, we were looking to see what resources were available to provide for our families. And part of what we do at Mickey's Miracles is wrap our arms lovingly around the families that we get to advocate for. And one of the issues that we saw more frequently was that of mental health, whether it's burnout or PTSD or grief or anger or all of the above, and how it showed up over and over again for the families battling pediatric epilepsy with their precious children. So we wanted to really dive in head first and really call in some of the best in the pediatric epilepsy community. Caring for Caregivers Mental Health Program is available for all parents and all caregivers of medically complex children, not just pediatric epilepsy, but Mickey's Miracles is primarily a pediatric epilepsy advocacy organization that specializes in getting families to a level 4 epilepsy center urgently for diagnosis and treatment, and then really following that family through every step of the journey and providing whatever support we need. And one of those key areas of support certainly is mental health. So we wanted to create this program. We've gotten some fantastic conversations out of it. We've, I think, started to raise the awareness of the importance of just admitting that this is hard and that this journey isn't easy, and it's not easy if you do it alone. So we wanted to create a community and a conversation around the idea of mental health for caregivers. With that, I want to introduce Erin, and just to kind of lay out the format, Erin will do a short presentation, then we'll have a kind of exercise, and then we'll open it up for questions and answers. So if you have a question as Erin is presenting, please put it in the chat. We'll be reviewing the chat for questions as they come in. We've already gotten a number of questions submitted via social media, so we'll be sharing those as well. But we invite all of you watching now and at home to please put whatever questions you have in the chat so that we can get to those when Erin is done with her presentations. Erin, welcome. Great to see you again.
Hey, thanks, Dario. I appreciate y'all having me. Sorry,
Yeah.
this is Mowgli. This is one of two of my little buddies, and he is stuck in the
Hi,
office,
Mowgli.
which means that he's going to climb a little bit. So I'm sorry if he's distracting, but he's my friend. So as Dario said, I'm a pediatric nurse practitioner. So I come at this from a little bit of a different angle because I'm working with my families in clinic and trying to help support them in this journey. So I am not a mental health person. I have fallen into the mental health space because, as Dario has said, I, along with Mickey's Miracles, have recognized just how important this is to talk about and how much support is needed. And so when we were talking about kind of one of the things I wanted to chat with you all about today, the conversation came up about pouring from an empty cup. And I know that is something that's said a lot, right? And I wanted to take a step back and think about what does that mean? But also thinking about how does that affect you as a caregiver of a medically complex child or loved one? Because I think it's so easy to get wrapped up in your loved one's needs and forget about how neglecting your own needs can negatively impact your ability to care for that child or that loved one, but also your ability to meet their needs. So I'm going to share a screen real quick. Let's make sure I share the right screen with you all. All right, so hopefully you guys are seeing a nice little wheel diagram right now. So this is from a theory called trauma stewardship. So in nursing school, we learn about something called trauma-informed care. And what trauma-informed care is it's teaching us as medical professionals how to respond to people in high stress situations and recognizing that previous trauma, previous instances impact how that person responds. And so it's trauma-informed care is the medical professional interacting with somebody. Trauma stewardship is recognizing you yourself, how that trauma has impacted how you interact and engage with the world. And so this is one wheel of components, symptoms, and things that you may see in yourself as you are chronically pouring from that empty cup, as you are chronically not filling yourself and not rejuvenating yourself. And some of these things might speak to you and some might not, and that's okay because we're all different. So we're all going to experience this differently. For some, that negative bias, not assuming well, may be really strong, right? You have that voice in your head that says, this doctor's appointment is not going to go well. This medication is not going to do its job, or something else is, the next shoe is going to drop, because that's what your experiences have been. Or you see this loneliness, isolation, which I call out in particular because you're helping break down those walls by being present in this group, but it makes it hard to engage with other people, right? When you have that experience and that trauma, and then you call your friend who's not dealing with a chronically ill loved one, and that friend says, oh, I just had the worst day, right? The grocery store didn't have what I needed, so I had to go to another grocery store. And in your head, you're screaming, how is this a rough day for you? Right. And that chronic exposure is going to change how you interact with the world. So as you go around this circle, we see some of the other things that are more negatively going to impact how you're able to care for your loved one. So we think about that fight, flight, or immobility, fight, flight, or freeze, right? Response, that when you're in that high sense, that next thing that tips you over, you hit that fight, flight, or freeze. And I don't know about you guys, but I'm a freeze person. So I hit that moment and I'm just like, I can feel all the anxiety. I can feel all the need to move, and I can't take that first step. We have those dissociative moments, right? Where you don't know where the last 10 minutes went, but you went somewhere. Inability to see options, diminished creativity. I think we all know how important creativity is when we're dealing with children with complex medical needs, right? I don't know any parent more creative than my parents dealing with complex medical needs. And if we're pulling away from that, we're limiting your ability to come to those creative solutions for your child. And then we get to the physical stuff, right? Those physical ailments, headaches, abdominal pain, GI upset, depression, anxiety, chronic exhaustion, right? You're tired all the time, but then you lay your head down and your brain tells you you have to be busy, you have to be doing things. So these are the symptoms that we see when you're dealing with that chronic trauma or that chronically pouring from the empty cup. Another way to look at that, and hopefully you guys are now seeing the other screen. Did that switch, Dario? Okay, great. Thank you.
I was giving you a thumbs up
sharing
because I'm mute. I have noise in the background, so I'm trying to
You're
not be
good.
disruptive
Screen
here. But
sharing
yeah,
is
thumbs
always,
up.
you always got to double check. So this
It
is
is
another way to
tricky.
think about this. So we think about all those symptoms, and those are very abstract, right? To think about like loneliness and guilt and those kinds of things. So this is a helpful diagram for people who are less abstract, who like concrete things. So in that top brain is how we process when we're recharged. When you've given a little bit to yourself, it doesn't have to be a lot, but when you've given a little bit to yourself, you have an easier time with executive functioning. So what does that mean? That means you can understand cause and effect. That means that you can be focused. It's easier to be productive. You are regulated. You can compromise. The frontal lobe, those executive functionings, which is what gets inhibited in that chronic trauma. Think about your classic teenager, right? What do? They do things without knowing what's going to happen, right? Or not really caring about it. They can't empathize with other people. They're all over the place, right? So those are the kinds of things that we're going to see when you're in that chronic trauma state. So when we look at that other brain, that lower brain, don't see the implications. You lose your train of thought. Your attention's divided, right? You've got 20 tasks going on and you don't know where you are in any of those 20 tasks, but they're all happening at some point. You're irritable. You can be rigid. So we do it this way because this is the way I have to do it. So those are other kind of more concrete examples of what we're going to see in that chronic trauma exposure. So looking down those contributing factors, right? For us, it's that chronic day-to-day trauma, that urgency, multitasking, not taking breaks, right? I can't take a break because I have to get it done. It's all of that that feeds into that cup being empty. Versus on the green side, these are the things that can be helpful for us because we can't change the situation, right? You can't change that you have a child with complex medical needs that needs your support, but you can change your response to those things. And that's where you're going to help fill that cup back up. So letting go of non-essential decisions. Caregivers are terrible at this, right? You want to have control over everything, but let go of some of those non-essential decisions. Does it really matter what is for lunch or breakfast? Maybe for some people, but maybe not, right? Does it really matter what color socks we're wearing that day? Probably not. So let go of some of those things if you can. Decrease urgency. So if things don't need to be done right that minute, make a list, write them down so that you don't forget them, because that's where that urgency comes from, is if I don't do it now, it's not going to get done. So if you make that list, it's going to decrease that urgency. Maximize breaks when you can, right? So if you can take 2 minutes to go do something, look at the sun, get a breath of fresh air, just those quick minutes to take the break. And when you're taking the break, take the break. Tell yourself, I am taking 2 minutes to myself and I'm going to breathe. And we're going to do a little exercise like Dario said. But I don't care where those 2 minutes come from. I don't care if that happens when you're going to the bathroom, right? And you close the bathroom door for 2 minutes. That's fine. But be mindful of, this is my break right now. Right now, I'm going to be present and I'm going to be mindful of where I'm at, because that's going to break the cycle. So nothing like being present helps break the cycle more. So having that moment. Some of the other things on this list may or may not be helpful for you, but again, we're all different. So some things are going to help. I think it's adorable that sleep's on this list, because I think we probably in this group all know how important sleep is, and probably in this group all struggle with getting sleep, right? So that's one of the harder things to kind of get there. But if you can notice what's going well at the end of the day, say, what worked for me? What didn't work for me? Talk back to that voice of urgency that tells you you need to keep doing things and you need to be busy, and say, that's all going to happen tomorrow. That's all going to be okay. Or that doesn't need to happen right now. Or I put A, B, and C steps in place so that tomorrow it's easier. So I hope that makes a little bit of sense in thinking about some of this. I'm going to stop sharing so that I can see my screen a little bit better. But all of that, the idea is to change how we interact with the world, because that chronic trauma isolates you, makes it harder for you to interact with the world. And we can't change that chronic trauma, but we can change how we interact. So one of the things that's not going to be part of kind of our practice today, but one of the things that I want you to think about in those moments is be present. So the example that I gave, because it's one I struggle with, is talking to particular people who tell me just how terrible and busy their day was. And I just want to scream, because how do you understand what busy is, right? So what do? I take a moment before I call that person and I say, is today my best day? Is today a day that I can be present with them, that I can be empathetic with them, or is today not that day? And it's okay sometimes to say, not my day. I have used my empathy elsewhere. not my day. That's okay. That is filling your cup. All right. But the days that you say, yeah, I have a little extra energy to work on my empathy, to work on being present. And what you're going to do is you're going to do that task and you are going to put out your perception of the world. You're going to forget how busy your world is. And you're truly just going to listen to that person and empathize and experience what they're telling you without any of your own judgment on it. And that's hard. Okay. You're going to have that voice in the back of your head that's just like, this is crazy. Why am I doing this? But the more you practice that, the more you're going to pull back from that edge and fill that cup and pull out of that isolation a little bit. So again, that's just one example of being present in that moment. But I want you to think about one thing that you can do to help you be present in your day-to-day, whether that is when you're getting your child's formula ready, what does that smell like? You know, is it vanilla smell? Is it what does it smell like? And actually process some of those experiences. And it can be big things like working on empathy, and it can be little things like I'm just going to be present right now, right in this second. So again, that's a bigger exercise that we're not going to work on in this moment. So the thing that I want you to work on this moment is something that we worked on last time, which is we're going to all uncross our legs and our arms, because anybody who's anxious or stressed, we do this thing, right? Like you're going to be as tight as possible. So I want you to uncross all of your legs and arms, and I want you to sit with your feet flat on the ground, the best of your ability. I'm a short person, so that's always hard for me. And you're going to close your eyes. And as you close your eyes, you're going to breathe in through your nose, and you're going to blow out through your mouth long and hard. And you're going to keep that cycle going. And in through your nose. Notice any smells that might be in your room. Out through your mouth, long and hard. And now with that next breath in through your nose, I want you to feel your feet. Do you feel the socks on your feet? Let it out. Are your shoes or slippers? Is something tight? Breathe in and let it out through your mouth. And then up to your calves and shins. Breathe in through your nose and out through your mouth. What do you feel there? Anything tight? Anything sore? In through your nose and out through your mouth. Work your way up your body. And as you work your way up your body, I want you to be mindful of what do you feel? Do you feel the clothing on your skin? Do you feel a tight spot? Is the chair funny on your body? Are your earbuds bothering you in your ears? Where does that stress sit? Does it sit in your jaw? Do you have a tight spot in a muscle on your leg? Where you bent over your child's bed and your back's bothering you? Find that spot. And as you breathe in, expand into that spot, fill it up with air. As you let it out, let all that pain, that stress, that tightness out with your breath. Breathe in again to that spot and blow out that stress, that tightness. I want you to breathe in, start to come back to yourself. Let it out and slowly open your eyes when you're ready. And that took all of 2 or 3 minutes. And as you're falling asleep before, laying in bed, thinking about all that stress, try to do that instead. Or that moment before you go into your next doctor's office visit, when you're sitting in the car, take that moment during your security check-in or while you're sitting in the waiting room, because we know that none of us providers are ever on time. Take that minute for yourself to just check in. And that's what I've got for you all today.
Erin, I love that so much. And, one of the things that I do, and mind you, I don't care for a medically complex child, but I have my ordinary life stressors, right? Financial stress, family stress. I got a 19-year-old in college. I have a 21-year-old out of the house. I have a 12-year-old that is mischievous. And then I have my bonus kids. And it's the Brady Bunch for sure. But one of the things I ask myself when I wake up is what am I do like a quick check-in with myself. Like, am I feeling anxious? Am I feeling anxious about right now? Is it a future event I'm anxious about? Or am I having a particular challenge with scarcity or abundance mentality? Or am I having a challenge with gratitude? And I'll literally Google gratitude meditation. And if I have 10 minutes, I'll Google 10-minute gratitude meditation. If I have 5 minutes, I Google 5-minute gratitude meditation, or whatever that is, whether it's anxiety or depression or fill in the blank. With me, I run the gamut of that wheel, and that's really helpful. And so I really appreciate, the reminder that it doesn't take a long time to get grounded. It doesn't take a long time to self-care. And I know that, the parents that right before I got on this call, which is why I'm having a little bit of technical difficulties, I had a call with a mom who was grateful beyond belief because they found an abnormality in her child's brain. What does that mean? That means that child is now a candidate for brain surgery. This child's been, experiencing 70 seizures a day on average for the last 4, 5, 6, 10, 12, 14, 16 days. Can you imagine the wear on that particular mom? In that case, a mom, I know, obviously, I don't want to exclude warrior dads, but in this case, it was a mom. And to hear the relief in her voice, her child is now a candidate for brain surgery, and the happiness with it. I mean, I could just feel the release, So, that's a long way of saying, like, we know this is tough stuff. And it's not meant to be easy, and we don't need to minimize how hard it is. But we do get to look forward to opportunities to really take care of ourselves a little bit, and I think breathing and that kind of mindfulness or presence exercise, is really helpful. And one of the questions we got, Erin, that I want to kind of transition to is, you deal with is that the right way? You care for a lot of parents who obviously have children dealing with some difficult stuff. Like, one of the questions we got was, how can I, in the clinical setting, ask for help with respect to my own mental health?
I think you got to know your provider as far as how to approach that conversation. And I think the unique thing about pediatrics is we address a family unit as our patient or as the group that we're caring for, right? Because we recognize the importance of all of those things. So thinking about your epilepsy centers, particularly level 4, but even level 3 epilepsy centers, most of them are going to have an embedded social worker in there. And social workers are mental health, like, magicians. They are amazing humans. So if your provider isn't as kind of connected with the mental health space as others, because I know I'm super connected in that, but others aren't. And that's okay. They're still fantastic epilepsy providers, but that's why we have social workers. So you can always ask for the social worker and to talk with them. And I think people get this kind of conception that social workers just deal with foster care situations and abuse concerns and things like that. The reality is most of what social workers deal with is mental health. And some social workers are even licensed to provide counseling, and they can be great resources for that. But a social worker can be knowledgeable about the groups in the area that help provide support. They can be knowledgeable about your insurance and how to navigate that for yourself as well as for your child. And they can be knowledgeable about kind of loopholes or catches if your insurance doesn't cover mental health resources. Social workers are also great advocates. So they can figure out, does your insurance offer a case manager for your child that then can alleviate some of the added burden onto you to give you a little extra space? Or is there a respite care option that, again, can alleviate a little bit of a burden off of you and give you some space? So not only just telling your provider, like, hey, I need help, I'm struggling, but also specifically asking for that social worker person to help connect and support with you long term, because they're going to be just a fantastic resource. And those should be prevalent in a level 3 or 4 epilepsy center. If you're at a private center or like a not hospital based, they often contract with social workers. But if they don't have access to them, then your provider is going to be pretty knowledgeable. And then the other person to not forget about is your pediatrician. They know their community. And so they're also going to be a really great resource for those mental health services. I can speak for myself and say, if I have a parent that looks at me and says, I need help with this, I'm in love. Because so often it's the other way around, where I'm sitting there telling them, like, here are the symptoms I'm seeing that concern me for you, and I worry about you. And if I have a parent that can raise their hand and say, I need help with this, oh, you're going to be my best friend. I'm going to be calling you all the time. You're going to be sick of me. So just saying something, I think, is the biggest first step that you can take.
And this is my own question, Erin, because I love your proactive approach to providing mental health support in that setting, and really giving and inviting, giving permission and inviting parents to share and to ask for support. And I've been around you enough to know that you invite that from them, and you almost seek it out because you understand it's almost like unspoken. From your experience dealing with parents, like, what are some of the things that, and I'll kind of frame, I'll give the context for the question when I'm done with the question, but what are some of the things that you hear parents minimize about what they're dealing with that really is an indication of, hey, there's some mental health stuff going on here that we need to find you support on?
Honestly, like, one of my, sorry, that Mowgli is just very needy. Um, one of my big flags is when I hear parents tell me kind of their list of concerns for the day. And then they end the visit by saying, oh, but I know some people have it worse than we do. And I stop them flat out right there, because comparison does not help us. We do not need to minimize our own experiences, regardless of what they are. They have value and they are impacting you. So that is one of the things that I hear most often that, to me, is a concern. Now, is that a concern for everybody? Absolutely not, because for some people it's an appropriate coping mechanism that they're trying to acknowledge there's a world outside of their own. But for a lot of people, that's something I say, like, let's back up. Let's talk about that. Tell me more about why you're telling me that. The other thing that I see from a medical standpoint is when I start to see that people are missing appointments, or that they are late on picking up medications. They're struggling to remember what pharmacy have what meds, because we all know the joys of specialty pharmacies, right? You can't get all of your child's meds from one place. They have to come from different pharmacies with different prior authorizations and different timings, right? Some are 90 days, some are 30 days. When I start to see gaps in that, that's the other flag for me of something's going on here, that we're really kind of coming off the rails a little bit. And so it seems silly that when I see those kind of concrete medical things, my question is, how are you doing? But the reality is as a caregiver, you're pouring everything into your child, into your loved one. And so if you're starting to struggle with those things, that tells me that you're empty and you've been running on fumes for a long time. So those are the big things. I think over time, getting to know parents, you start to kind of sense that some parents, the talking too much, and for some parents, the too little. it just makes me pause and say, tell me how you're doing, right? What's going on with you? I ask them how they are and they say, fine. We all know what fine means. So it's looking for those kinds of things that are both very clear, but some are more subtle to figure out where's my concern lie here. And I hope that answered your question in kind of a convoluted way.
No, it does. And as a follow up, I hear parents say, "Hey, like I'm not getting enough sleep, but that's okay," or "I didn't get a chance to do X, but that's okay because I had to do Y," and it's typically related to their child, So I hear like I'm learning enough about this through working with people like you and our medical advisory board and Dr. Wagner and Dr. Devine, and all the folks that we have the privilege of working as we create this community and invite this conversation about caregiver mental health, to kind of listen for the downplaying of how difficult this is. And like almost parents feeling like they don't have the right to not complain necessarily, but to ask for support, and they see it as a complaint versus an acknowledgement that this is hard and that they need support, and we've talked about in previous meetings how important it is to connect to community, how important it is to ask for help, how important it is to attend conversations like this, how important it is to, talk with other people who've experienced the same, kind of thing, even though every situation is different, that can, offer some empathy and provide some insight into coping and practical skills that are applicable to you. So really, I guess it was a question, but also a statement of like, it's okay to acknowledge that this is hard and that it creates, in some cases anxiety, in other cases, depending on where your journey, it might trigger a PTSD response. I mean, we were just talking about with Gabe, Christy's husband, Mickey's dad, they've been at this since Mickey was 3 months old. She's been seizure free over 10 years now. And recently she had some spikes, as she was sleeping, and they had to go back in for monitoring after a change in medication protocol. And I've never heard Gabe once talk about him being stressed or having a trigger response. And this time the conversation was different. He had a very palpable PTSD response. And when they got the news that, yes, the medication and the protocol has reduced the spikes overnight from 50 plus to 10 or 12, and we're still going to play with the adjustment medication to get this down to 0, like he was holding his breath the entire time. And this is a family that, is well-resourced. They founded Mickey's Miracles. Their daughter's been seizure free, by the grace of God and with the help of the folks at Talk and people all over the country, and they're still experiencing, that kind of trauma response. So really just an acknowledgement that, hey, this is tough. And it's okay to have, whether it's anxiety or depression or stress or fill in the blank. It's not okay to keep pouring out of the cup without pouring back into it. And one of the exercises we did today is obviously one of those examples. And one of the questions we got from parents, say, beyond like breathing exercises, like what are 2 or 3 things that we can do, on a daily basis that can help us with our cup?
Yeah, and first to kind of come back to kind of those PTSD trauma responses we see in parents who have been in the NICU, in the PICU, PTSD, like it is documented that families can experience that. And I don't think that we say that they only happen in those acute care scenarios, right? They happen in the hospital when you're dealing with trauma with your child. And so being mindful of that and that chronic trauma. And then to your point, the kind of minimizing, belittling, like, oh, I just do what I do, right? And it's hard because from the outside world, from the world that doesn't understand complex care, they look at you as a caregiver and what do they say? Oh, it's so hard. I could never do that. Right. And so what do you say in response? Like, I don't have a choice, right? I do what I have to do, or, oh, I just do what I gotta do. Because the conversation's hard and it's awkward to be like, yeah, this is hard, right? But every time you have those interactions, you internalize that, like, oh, yeah, it's fine. Don't do that to yourself, right? It's okay to protect yourself and say, "Yeah, I'm not going to have this conversation with this person." But it's also okay to sometimes say, yeah, it is really hard. And I use a lot of resources to get through my day. And that's great. I'm glad I have them. Or I could use more resources in my day. Would you like to be one of those people? To find that group and that support with you. And then to come to some of those other things that you can do. So we did that breathing exercise today. I always think you were mentioning kind of first thing in the morning, checking in with yourself, right? Even before you open your eyes, certainly before you grab your phone, ask yourself, how do I feel today? Where am I at on my scale? When I teach nurses how to do mental health assessments, I teach them about a doorknob assessment. So before you go into that clinic room, I want you to think, where am I at today? Where's my scale? Where's my cup? How am I going to approach this today? Because every day it's going to be different. And so having that quick moment of, where am I at today? Am I having a good day? Am I having a bad day? Did I sleep cruddy and just ruminating on whatever I needed to do today? What can I do to make that better? Take those 2 seconds and process through that. The other thing that you can do if you're experiencing just a high anxiety, high stress moment is something called the five senses approach, where you think about one thing you can smell, taste, touch, see, and hear. I tell families to like keep Tic Tacs or Mentos or something very kind of tasty in your bag. So when you're having that moment, you can pop that in so you can taste something, right? And if it's crunchy, you can hear the crunch and you can smell the mint and feel all those things. I futz with sticky tack because it gives me something tactile to feel with. So putting little things around your world that help you for when you need those five senses, that's another really quick, it's less than a minute to do that, and think about that and just help ground yourself in that moment. So to answer the twofold, sorry.
No, it's great. And what I also help, what helps me, and I have probably a little bit more time available to me than the average parent caring for a medically complex child, but just moving helps. Sometimes it's 10 minutes, sometimes it's 5 minutes, sometimes it's a stretch, sometimes it's a quick workout, sometimes it's a quick run. But I find that moving changes my disposition almost immediately. Now, we obviously have to make the space for it, and sometimes you have to schedule it and do it no matter what, and provided you have the right support, watching your child and that kind of stuff. So that's a factor I don't have to kind of worry about. But I understand moving is an important tool too that can help kind of subside whatever that particular mental health anguish of the day is. And listen, they run the gamut, and there's multiple, kind of things present, throughout the day even. So it's not like this linear equation of mental health, challenges. But I wanted to say, Erin, thank you. Your demeanor is just incredible. I know that the parents who walk into your office and who have a chance to chat with you, they feel welcome to talk about the support they need from a mental health perspective. And that's the kind of environment we're trying to foster, across all, healthcare for children who have medically complex issues, and make it okay for parents to acknowledge that it is hard and to ask for help and to support for community. That's a conversation that Christy and I took very seriously. It's why Mickey's Miracles Board of Directors and Medical Advisory Board very strongly supported the creation of a Caring for Caregivers mental health program for all medically complex, parent and caregivers of medically complex children, not just pediatric epilepsy. And again, I just want to thank you. I want to thank Jazz Pharmaceuticals. I want to thank Neurelis for their funding. Without them, this program could not be possible. And we invite you at home to please share your questions. If you have feedback for us, if there's a particular topic you want us to address, I apologize for the background noise. It's getting loud in here, but it's really important that we understand what you want us to address, and for you to share the things that you want us to support you with. We're here, and you can find us at mickey'smiracles.org. All of our previous Caring for Caregivers webinars are on our website. And until next time, thank you so much on behalf of the families we get to advocate for, on behalf of our CEO and visionary founder, Christy Grease, and our entire board. We appreciate you being part of our community. Thank you.